When nausea's got you down and out, ReliefBand is here to help. Whether it's from a car ride, cruise, pregnancy, anxiety, chemotherapy, migraine, or even a hangover, the ReliefBand works differently than anything you've tried before. The gentle pulses generated by the device interact naturally with the nervous system, avoiding the negative side effects of anti-nausea drugs and the inefficiency of acupressure bands. Keep watching to learn how easily the ReliefBand can turn life's uncomfortable moments into distant memories. Start by finding the right spot on the underside of either wrist. Place your index and middle fingers at the base of your wrist. The area directly next to your index finger is the location where the contact should be placed. Apply a small drop of conductivity gel to your wrist. Spread it in a circle roughly the size of a large coin until it creates an even sheen. This gel allows the therapy to penetrate the skin and stimulate the median nerve, and also ensures the most comfortable experience. Hold the ReliefBand and place the contact pads onto the gel you just added to the underside of your wrist. Then, fasten the device snugly. To turn on the device, press and hold the button on your ReliefBand for about 3 seconds. Use the button to adjust the therapy to the most comfortable setting. You should feel a light tingling in your palm and/or middle fingers. This signals that the device is positioned correctly. You may need to slightly adjust the position of the contact pads. When you're done using the ReliefBand, simply hold the button for 3 seconds to turn off the therapy. ReliefBand, for life's uncomfortable moments.